I'm here today with Mike Knapp. Mike is a member of Compass AmeriCorps, working with JFCS's Refugee and Immigrant Department as a medical caseworker. How you doing today, Mike?
Good. How you doing, Jordan?
Good, good. Before we get started, I just want to give a brief sentence or two about what Compass AmeriCorps is, in case the people watching aren't familiar. Well, AmeriCorps is a national service organization. It gives people the opportunity to do community service for a year. And Compass AmeriCorps is a division of AmeriCorps that is managed locally by Literacy Pittsburgh, in which AmeriCorps members are placed throughout the city of Pittsburgh with different organizations doing social services and English as a second language instruction, specifically with refugees and immigrants. So now we know what AmeriCorps is and what Compass AmeriCorps is. Let's find out about you. So I know that you went to college and you decided that you wanted to spend a year giving back through Compass AmeriCorps. What led you to that decision?
So I had decided fairly early on, actually, in my college career that I wanted to do that. It was in my junior year. I started interning with JFCS, and I worked under the previous Compass AmeriCorps member in my position, Kira Panzer. And we worked together to help connect our clients to healthcare services. And I was a pre-med student at the University of Pittsburgh at the time. So it was really kind of right up my alley. But I really didn't want to just dive straight into med school right after college. I wanted to experience the systems and what are the barriers to care for people, particularly this population that I really enjoyed working with during my time at JFCS. And I saw how well Kira did it and how much it informed her future plans in medical school. So yeah, I pretty much, as soon as I started working at JFCS, I knew I want her position. I'm going to take a year to do that before I go to med school.
Well, great. I'm glad that life doesn't always work according to plans, and this time it did. So
yeah, sometimes.
So I know you were recently named one of PennSERVE's Members of the Year. Congratulations, by the way.
Oh, thank you.
And that was because of the work you're doing to help make healthcare more accessible to people who are low English or non-English speakers. Can you share a little bit about why you're so passionate about this and how your work through AmeriCorps has helped you advocate for that?
Yeah, so I became more passionate about it as the year went on, because I went from seeing it as sort of an inconvenience for our clients and an inconvenience for the people trying to help provide these services, and then realizing that it's not just an inconvenience for our clients, it's really something of a public health emergency for the people affected by it. Because as I helped non-English speakers connect to healthcare services in Pittsburgh, I came to realize that without a certain level of English or a certain level of direct intervention from a third party, there's a pretty significant population that can't access these healthcare services without those English skills. So I realized that this is like a real problem and a real burden on the public health system that needs to be addressed. So that's how I became really passionate about wanting to advocate for that. And some ways that I've done that through Compass is really just making sure everybody who can do something about it knows about this problem. Whether they're going to do something about it or not is sometimes out of my hands. I've been connected to the International Patient Relations Department at UPMC, so I'm in touch with them. And on more than one occasion, we've had issues. I sent out an email, and by the end of the day, I got a call back from UPMC that it had been addressed. That person, that department, that staff was trained, and the problem doesn't exist within that specific setting. The widespread problem still persists, but chipping away at it bit by bit is one thing that I've been able to do through Compass and through JFCS that I wasn't really able to do prior. So that's a great opportunity that I've had that I hope I can continue.
That's really great. So what for you, Mike, has been one of the most rewarding things about your experience in Compass AmeriCorps?
The most rewarding thing I would say is definitely how intimately involved I am in our families' lives. Being their medical caseworker, I'm helping them connect to healthcare services, and in doing that, I'm aware of a lot of their medical issues, and so there's a certain level of trust that, of course, I make sure that they're comfortable with. I'm not attending their appointments with them if they're not comfortable with that. But in doing that, they come to trust me on a certain level, and then they come to me with issues that aren't always even related to their healthcare, which then I kind of have to try to help direct them to the proper resources. But then they see me as their advocate. They see me as an ally that they have here. And so through that, I get to be really a part of their story here in their new home in a way that is sort of uncommon. And I don't think I would have had the opportunity to do that in a less involved setting. So yeah, being so intimately involved, I think, has definitely been the most rewarding. And one specific example of that was one family. Although in 2021, we haven't been able to resettle as many refugees as we'd like, we have had a couple families, and one family that arrived in January, I got to be a part of their airport pickup. So I met them at the airport. I helped them get to the Uber that took them to their new home. I had helped be part of the team that had set up their new home. And then when their caseworker went over everything, all the laundry list of things that you have to go over when you first get to the country with them, I was able to, they had toys in the home that I could break out and play with the kids and get them comfortable in their new home. And then throughout the past couple months, I've worked with them really closely. So that's one family that I've really been right there from day one until now, and formed a really strong relationship with them. So that's probably been like the most rewarding experience.
That's really wonderful. Do you think other people should consider doing Compass AmeriCorps? And if you do, why?
I definitely think so. I think it can be difficult. Anybody who seriously looks into doing Compass AmeriCorps knows that you're not getting into it for the pay, and that you are going to be working a lot. So if that's something that you are okay with, working really hard, and not always being compensated financially, as long as you're comfortable with that, then it's definitely a really rewarding experience. And professionally and personally, I'd say I've developed in a lot of ways that I probably wouldn't have had I taken a gap year to do research like a lot of students do before med school, or to just work a job. Through Compass AmeriCorps and the perspective that I've gotten from working with a population that is in some ways drastically different than my own life experiences, but then also finding the ways that there's actually a lot of common ground. And so a lot of our realities have been similar. I think that's been incredibly rewarding and given me a whole new perspective on my own life and how my life relates to others. So I would definitely recommend it.
That's great. And I appreciate everything that you've done this year for the families you worked with directly, for JFCS, for the community. And I think you're a great representative of Compass AmeriCorps. So thanks for coming on today and talking to me about this.
Yeah, thanks so much. It was a pleasure to be here. So thanks for having me.
Sure.